today about the WIC program and its role in addressing hunger and food insecurity issues. Let me tell you a little bit about myself. I've worked with WIC for about the last 15 years. And my current role, I develop nutrition solutions for nutrition programs, including WIC. GCOM is probably the largest WIC provider in the United States. Currently, about 43% of all Americans on WIC do so with our systems. Prior to that, I actually worked with the state of Virginia. Virginia was part of a consortium of 4 states that developed the Crossroads WIC system. And so I was lucky enough to be their project manager and help them implement their new system and convert to EBT. Hopeful that the discussions today will help with the solutions being developed here at the Datathon and help with the ideas for hunger and food insecurity. Thanks for having me.
Thanks, Jay. Jay, can you tell us a little bit more about WIC and its connection to the Datathon?
Sure. WIC stands for Women, Infants, and Children, and it's one of 3 major programs funded by the U.S. Department of Agriculture, and specifically the Food and Nutrition Services branch of the USDA. The 3 programs that people have probably heard of, the first is SNAP, which is also known as food stamps. The second one is generally known as the school lunch program, but there's a variety of other programs that provide free meals for kids outside of school in the summer or for senior citizens living in senior centers. And then WIC is the third of those major programs. WIC is kind of unique between the 3. In part of the way it's run, it's much more data-centric than other programs, and it involves more than just providing food. One of its primary missions is to support breastfeeding and to make sure that mom is healthy at the time the baby is born. It also has an emphasis on providing ongoing nutrition education, so mom can do a better job of managing the nutrition of her household. And then it's also known for providing food supplements. Specifically, it provides infant formula if necessary, and it also provides food to mom, prepartum and postpartum, and it can provide food for infants as they age and become children up to the age of 5.
So Jay, with all the data out there, can you share some of the types of data that is collected by WIC and that may be important for either individuals within WIC or individuals within the Datathon today?
Sure. I think amongst the USDA programs, WIC is unique in the volume and the breadth of data that it collects. Like a lot of social service programs, it collects a lot of information about the household and the members of the household income to find moms to be qualified for WIC. But in addition, it tracks a lot of nutritional data and other risk data associated with the household. That starts with anthropometric data, where you collect height and weights and blood work for mom, prepartum and postpartum to make sure that she's having a healthy pregnancy and a normal pregnancy. We also are collecting that data for infants and children. So we're maintaining growth charts, growth curves, and letting moms see how those nutritional outcomes are progressing with their infants and kids. We collect complex health screening data, which helps us build a collection of up to several hundred risk factors for the household. We collect a lot of very detailed data about breastfeeding success and history and education for mom, because that's, again, one of those major initiatives in WIC is to make moms be more successful with breastfeeding longer, which has a lot of strong outcomes for infants. And I think just in general, it has a lot more data than other programs, which it then uses later on when we go to deliver services.
Thanks, Jay. And again, as a connection to those within the Datathon today, a lot of other data sets in terms of transportation potential needs, distance from services and or food sources. So I think your points are very spot on and very applicable, both within WIC and for our participants today. So Jay, we've talked about what kind of data is collected. Can you share a little bit about how that data is used to really drive outcomes?
Yeah, let me talk about how we take that data and make it available. And really the key when we build WIC systems with that much data being collected is making sure that the practitioners understand the data and they have access to the data at the right points in working with a mom. And some good examples are WIC actually works with a food prescription. So unlike a program like SNAP, where mom just gets a cash benefit and can buy anything, WIC is designed to make sure that the foods being given to the family are specific to their needs and are nutritionally valuable. So at a certain point during the appointment, mom and all of the individuals in the family are given a food prescription. And people may not know, we're all familiar with infant formulas. We typically see 5 or 10 of them in the store, but there's actually hundreds of infant formulas available that meet very specific nutritional and metabolic needs. So WIC is prescribing medically necessary formulas. And so when we get to that moment, we need to see lots of information about the family. And a good example would be allergies. So we'll want to know what allergies are in the family to make sure that we're not prescribing peanut butter if there's a peanut allergy or nut allergy. And we need that data available as well as prescriptions so that that food prescription matches the family's need. Another key area is nutrition education. WIC actually requires that participants participate in nutrition education every month in order to receive benefits. So we take data from the health assessment and other parts of the data collection so that the certified professional authority who's working with mom knows about topics to discuss with mom, or can refer mom to outside nutrition education where she can address those specific needs. And then I think finally, the last one I'd talk about would be breastfeeding support. Again, one of the major goals is to improve breastfeeding. Moms who breastfeed have more successful outcomes. It's very hard in a lot of populations to achieve good breastfeeding rates for a long period of time. So WIC is tracking a lot of very detailed information about mom's background and experience in breastfeeding and success. And they have staff ranging from peer counselors, or just people who have had experience breastfeeding, to breastfeeding experts who can help with more detailed issues. And they need to know all of those details. And so, for example, in certain states, mom can call at midnight if she's struggling to be successful and get very specific guidance to help. Because really with breastfeeding, if there's any period of time where they're unsuccessful and they shift to formula, it's very hard to go back. So having access to that information, tracking it so that every time mom speaks to someone, they can be successful is really critical in WIC.
Thanks, Jay. And again, I think you highlight a very key point for our participants today. It's about knowing where the individuals are and meeting them where they are, and understanding more about how we can help in each in separate ways as well. So it's not a one-size-fits-all approach at all. It's got to really be meeting individuals where they are with a tailored approach as well.
Absolutely.
Jay, you've hit on a lot of great information. Thank you very much for your time today. As our participants in this data-thon begin to make their solutions, there are many things they should be thinking about. Let's talk about a few of those right now. As they think about outcomes, what are some of the things they should be considering, and some of the things that you've done in the outcome space to move individuals forward?
Sure. Because WIC collects so much data and it's such an important part of the lifespan, a lot of WIC data is used for a variety of research projects. USDA mandates that certain data sets be exported from WIC for that purpose. And as a result, there's a lot of really good research, longitudinal research about potential outcomes or observed outcomes. And some good examples are infant mortality is actually reduced by 33% for moms who participate in WIC. We see improved cognitive outcomes that extend up to their school age, much after their years in WIC. We see generally better engagement with healthcare and immunization. And then finally, we actually see cost savings. For every dollar spent on mom prepartum, there's about $2.58 in savings postpartum. So we actually see that it's a program that pays for itself with successful outcomes.
Great point. And you mentioned cost. Talk a little about cost containment. Are there things we should be looking at in our solutions to ensure that we're making the best investments and putting the money in the right places as well?
Yeah, I think one of the things that's really innovative about the WIC program, there's differences of opinions about social service programs, but I think we all want to make sure that dollars spent are well used. So WIC does something really unique. We actually authorize foods at the UPC level. We divide foods into categories and subcategories, and then states elect which foods to authorize. So they may not authorize a food that's too expensive or doesn't meet a nutritional need. And they actually divide vendors into peer groups. So we'll treat a Walmart separately from a convenience store, which has a different cost basis. And so all of those things are being approved so that we only pay up to a certain allowable limit. We'll statistically calculate what a reasonable price is. We'll set price limits. So we're restricting what can be bought, where they can be bought, and what the maximum price is. So there's a much tighter relationship between the money being spent and the outcomes we're trying to achieve.
Thanks, Jay. Let's talk about location as well. I think location is so key as we're trying to address the hunger crisis we're all facing. Can you talk about location and how that could play a role in some of the decisions made in the solutions we have today?
Sure. Another element of vendor management is that the states have vendor management agencies and they're authorizing vendors around the state. And they're looking to make sure that they have appropriate vendors that have access to all of the foods that are necessary throughout the state. So we're looking at locations and authorizing based on the need in that area so that we don't allow food deserts to occur within the state. And that's another big part of the vendor management process.
Thanks, Jay. And finally, I think another key contributor or a key consideration for our teams today is the experience of the individuals we're trying to serve. Can you talk a little bit about the experience and things we should keep in mind as we look to develop a solution for individuals?
Sure. Let me talk about one of the biggest challenges with WIC. WIC used to offer checks. And so a check might have 5 gallons of milk and 2 pounds of cheese and a box of cereal. But that meant several things. One, mom had to buy exactly those items when she went into the store, and she might not need 5 gallons of milk this week. What's available in the store may only be good for 4 days, and it would be better to break that up. So Congress mandated by 2020 that all states switch to electronic benefit transfer, which is like a credit card, but acts very differently. It still meets all of the WIC rules, but that had a really dramatic effect on women who participate in WIC. And you hear stories about people who would go at midnight because there was a WIC only lane and they didn't want to be separating their groceries in front of a line of people and the social stigma. Now with EBT cards, which Virginia completed a number of years ago, mom can go to any line in the store. She can process all of her groceries, swipe the WIC card, pay for those, and then swipe a credit card and pay for the rest. And no one in the store needs to know that she's on WIC. And that has a huge impact on participation and social stigma being involved in the program. And we're also modernizing with tools like mobile apps so that mom can find a store, she can confirm what benefits are available, and within the store, she can scan barcodes and confirm that the item she's picking up is eligible before she goes to the checkout. And all of those things have made just a huge difference on experience, and ultimately we hope will lead to participation and maintenance in the program and better outcomes.
Jay, some great transformations in the WIC space and some great food for thought for our participants today as they're developing their solutions for the data fund. Thank you.
Thank you.
Jay, as we wrap up today, I wanted to also talk about some of the challenges that you see for WIC and maybe for individuals as they create these solutions today as well.
Sure. So WIC is in an interesting position. Really, its strength is also its weakness. Because it collects a lot of data, it has a lot of asks of mom to participate. She's required to complete nutrition education. And typically in the past, she's had to come into the clinic. COVID has been a major change for WIC. When people can't come in, we have to operate under waivers. And I think really the challenge is to keep people in WIC. What we see is people leave WIC, when they have formula, which is very valuable, they participate, but when they their children become older and they become children, the value of the benefits go down, the cost of participating is high, and people tend to leave the program in favor of other things. So really the goal is to make services as convenient as possible so we keep people in the program and continue to achieve the outcomes.
Wonderful. Thank you for that point, and that's a significant challenge that I know everyone is working hard to address as well. So thank you, Jay. Let's talk about a different challenge in terms of data sharing. I know another challenge within WIC is the ability to share data amongst the programs. Can you tell us a little bit more about that as well?
Sure. I think that issue is really twofold. WIC creates a lot of really amazing data sets about a really important time in a child and infant's life. That data is used in research. I'm not sure that it flows as well as it can to education, Medicaid, and other programs to ensure a continuum of care because they're operated out of different agencies. And I think another key issue is there's a lot of emphasis right now on making sure that people who participate in Medicaid or SNAP are also enrolled in WIC. And we have a lot of issues to make sure that data is moving between those programs so that we have the outreach and we're getting participation in all the array of services that we want to see a family participate in.
Yeah, Jay, that's a very good point. I know Virginia, outside of WIC, has just made some significant improvements in this space through the Office of Data Governance and Analytics, through a lot of the work in terms of data trust that we have now in place here in the Commonwealth. So for the participants in the Datathon, I think it will be very important to understand some of those challenges and also the opportunities that are available within the Commonwealth to share that data as well. Jay, I want to thank you for your time today, and thank you for giving the individuals on the Datathon some food for thought, and also some opportunities to learn more about a program that's very important, not just to the Virginians, but to individuals around the country as well. Thank you, Jay.
Thank you for inviting me. I appreciate the opportunity to be here, and I hope everyone has a great Datathon.